Hey everyone, today I'm going to talk about the cardio lab that we all did. First of all, patient A, he came in complaining of syncope. He also mentioned that he lost his sister earlier due to heart disease. The patient is about 30 years old and he's very tall and skinny. Upon auscultation, we heard the heart sound that would indicate a systolic murmur. The reason it was systolic was because the murmur occurs between the lub and dub, like the first and second heart sounds that, indicate systole. Upon echocardiogram, we saw that the aorta had increased in size, which can indicate an aortic aneurysm. Aortic aneurysms are kind of dangerous because they can cause aortic regurgitation and a whole bunch of other problems. These patients will probably need surgery to correct it. Upon the MRI, we could confirm what we saw in the echocardiogram, that the patient is clearly suffering from a dilated aorta or an aortic aneurysm. With the pedigree findings, we saw that this is now a dominant pattern of inheritance, and we didn't do an ECG. For patient B, he was referred to us by his physician. He was breathless, he had an erratic heartbeat, he was only 35 years old, and he is a dwarf. Let's see here. Upon auscultation, the heart sound, like the first and second sounds, were abnormal. Like the lub and the dub are not like single snapping sounds, but they're like multiple smaller sounds that you can hear. As we saw in the echocardiogram, the wall between the right and left atria is missing, and it's a form of atrial septal defect. An MRI was not done, and neither was an electrocardiogram. So for his pedigree, the lineage would support an autosomal recessive pattern. For patient C, who came in complaining of dyspnea and fatigue with strenuous activity, he's 55 years old but has a normal build. Upon auscultation, we could see that the patient was clearly suffering from some kind of heart condition because he had a murmur. The ECG showed that the mitral valve, or one of the leaflets, was thickened. An MRI was not done, and the condition, based on the pedigree, didn't seem like it was heritable. And again, no ECG was done. So, for diagnosis, patient A, based on all the findings, we would say that he was suffering from Marfan syndrome. It's an autosomal dominant inherited disease, and it affects the connective tissue with varying degrees of severity. We were kind of clued into that because he was very tall and skinny. Can also be some characteristics of that disease. Patient B, based on the findings, we could see that he is most likely suffering from Ellis von Creveld syndrome. It's a rare recessive disease that is unusually common among the Amish people due to founder effect. Some characteristics of that was dwarfism and extra digits. And for patient C, based on his findings, we can pretty much diagnose that he has mitral stenosis. Auscultation showed that diastolic murmur, which is consistent with that disease, and the echocardiogram confirmed that one of the leaflets is thickened and has low mobility, which is another big sign of this mitral stenosis. Thank you.